afternoon, everyone. I want to thank you for joining the Superior Health Quality Alliance Roundtable conversation around the COVID-19 vaccine and immune response. My name is Jerry Henniker, and I'm joined by my colleague today, Kim Hoft, as well as our guest speaker, Andrea Becker. For those of you who have been joining these meetings over the past few weeks, welcome back. We love having you all here. I know some of you may be new to this call, and we're glad to have you here for the first time. Just a little background, we host these sessions each week. They are a 30-minute education session where we highlight important topics that are related to COVID-19 vaccinations and the boosters. We hope you'll be able to join us for each session each week. One of the things that we're hoping that you get from these sessions, or that we're hoping you can provide us with actually, is if there's any like pebbles in your shoes, those things that are bothering you or that you're struggling with and having problems figuring out, those are what we want to address during these sessions. So if you have something like that, please feel free to send me a direct message via the Zoom chat during the session, and we can hopefully get that added as a topic for a future session. I wanted to let you know there will also be a survey at the end of this session. We ask that you complete it. It only takes a few minutes to do. Answering these surveys are very helpful for us. It helps us know what's been helpful and also what isn't helpful during these sessions. We will also put the link to the PowerPoint presentation in chat in just a moment here. You have the opportunity, please do so, to use the chat box during the session. You can add any comments, any questions you have, or anything else that might pop into your mind when we're giving the presentation today. We'll use these for discussion if we have some time remaining at the end of Andrea's presentation. And with that, I'm going to turn it over to Andrea. The floor is yours.
All right, thank you, Jerry. Thank you so much for having me here today to talk to all of you. It's great to be here. My name is Andrea Becker, and I'm an immunization nurse educator with the Michigan Department of Health and Human Services. I've been with the department for just about 6 years. And just to give you a little bit of a background on myself, prior to coming to work with MDHHS, I worked at the Ingham County Health Department in Michigan for 6 years there as well in the immunization clinic. So I've had a lot of experience in immunizations, and it's my passion. I really enjoy educating on vaccines. And so I'm excited to be here with you today. You can go ahead to the next slide there, Jerry. So these are just some objectives that we're going to cover today. We're going to go over primary series and booster dose recommendations for the general population, as well as for those who are moderately or severely immunocompromised. We're also going to discuss co-administration guidelines for COVID-19 vaccines. We'll talk about monoclonal antibody treatment and the timing with that and COVID-19 vaccines, since there's been an update with that. And then I also want to just give you resources, the interim clinical considerations and the emergency use authorization fact sheets, letting you know where to find those. Next slide, Jerry. And you can go ahead and go to the next slide. Next slide. Sorry, I have lots of title slides here. All right, so just to kind of get started, I just wanted to give a brief overview of the COVID-19 vaccine formulations, just so you're aware of all of the vaccines that are available out there. There are 3 different products for the Pfizer product. You'll notice there is one down to the age of 5, so 5 through 11, they have a product for that. Then there's 2 products for those who are 12 years of age and older. They're identified by different cap colors. You'll see there's purple and gray. Oh, can you go back a slide? There we go, thank you. And then for Moderna and Janssen, you'll see that those are both for 18 years of age and older. And I actually have Moderna highlighted in red here. And the reason for that is because there's a different dosage between the primary series and the booster dose. You'll notice for the primary series, the dosage is 0.5 ml. And then for the booster dose, it's 0.25 ml. And so this is a really important point, especially for individuals who are going to be preparing the vaccine and administering the vaccine. So it's just a good point to make sure that you're aware of. Next slide, please. Now we're going to get into talking about COVID-19 vaccine primary series and the booster dose recommendations. Next slide, please. As you know, there have been a lot of changes that have happened really quickly over the last couple of years. And so I want you to focus in on this chart where you see the red box. I'm not going to talk about the age group 5 through 11 because that doesn't really pertain to this group. But I do want you to focus in on that red box. And so this is going to be the recommendation for the general population. And when I say general population, that means those who are not moderately or severely immunocompromised. So when we look at Pfizer, that is for those 12 years of age and older. And the number of doses in a primary series is going to be 2 doses. And then they also get a booster dose. Now, your interval between your first and your second dose is going to be 3 to 8 weeks. And this is something that just changed as of last night. So it used to be 3 weeks or the 21 days. And now they've added a potential 8-week interval. And this, I'm going to grab my notes because I don't want to mess up saying this because this just came out just last night. But this is for some people who are age 12 through 64 years of age. And especially in males ages 12 through 39, you can consider that 8-week interval. And the reason for that is because we know that there is a rare risk of myocarditis associated with vaccination with mRNA vaccines. And so this risk might be reduced by extending the interval between the first and second dose to that 8 weeks. I do want to point out that this does not affect the recommendation for those who are moderately or severely immunocompromised, adults 65 years and older, and then individuals who might need immediate protection. So depending on the community level of transmission, if it's high, you may want to stick with that 3 weeks, but it is an option. You can go to the interim clinical considerations to read a little bit more about it, but this is something that was just released last night in the interim clinical considerations. So those are your intervals between dose 1 and 2, your interval between your primary series, so that second dose of your primary series, and then your booster dose is going to be 5 months or greater. When we're looking at Moderna, now remember Moderna is only 18 years of age and older. You're going to be looking at a 2-dose primary series with 1 booster dose, so very similar schedule to Pfizer. And then the interval between the first and second dose is a little bit different. It's 4 to 8 weeks. So 4 weeks is what we've had before, which would be the 28 days between the doses. And now there's that potential for the 8 weeks and the same recommendations that I just mentioned, the 12 through 64. And then especially want to consider it for males 12 through 39 because they're the ones who are at an increased risk for that myocarditis. Then the last vaccine is the Janssen or J&J vaccine, and that is available for those who are 18 years of age and older. Now, the Janssen vaccine, due to the risk of thrombosis with thrombocytopenia syndrome or TTS, is now considered kind of the last resort. mRNA vaccines are preferred over the Janssen vaccine based on the risk-benefit analysis that they did in regards to TTS. So with Janssen, if they do receive Janssen, it's a 1-dose primary series and then 1 booster dose. And the interval between those is 2 months or greater. Next slide, please. So now we're going to get into talking about the recommendations for moderately or severely immunocompromised people because those are different. Next slide, please. I threw this slide in here because I wanted to give you an idea of some of the conditions that are included in this category for moderately or severely immunocompromised. And those include active treatment for solid tumor and hematologic malignancies, receipt of solid organ transplant and taking immunosuppressive therapy, receipt of CAR T-cell or hematopoietic stem cell transplant, moderate or severe primary immunodeficiency, advanced or untreated HIV infection, and then active treatment with high-dose corticosteroids, alkylating agents, antimetabolites, transplant-related immunosuppressive drugs, cancer chemotherapeutic agents that can be classified as severely immunosuppressive, TNF blockers, and other biologic agents that are immune suppressive or immunomodulatory. Now, this list, it's not limited to this list on who can be considered moderately or severely immunocompromised, but these are the conditions that are listed in CDC's interim clinical considerations. So it's possible that somebody may, be considered moderately or severely immunocompromised based on clinical discretion. Next slide, please. Okay, so now we're going to look at the primary series and booster dose recommendations for moderately or severely immunocompromised, and we're going to just focus in on mRNA vaccines first. These are the vaccines that are preferred over the Janssen vaccine. So let's take a look at that red box on the chart. If you look at Pfizer, again, this age group is 12 years or older. The number of primary vaccine doses is going to be 3. So this differs from the general population that we just talked about, which theirs is 2. So with moderately or severely immunocompromised, it's going to be 3 primary vaccine doses. And then the number of booster doses is going to be 1. The interval between your first and second dose is 3 weeks. And again, remember that new 8-week interval does not apply to those who are moderately or severely immunocompromised because they're at a greater risk and we want to get them protected as soon as we can. And then the interval between the second and third dose is going to be 4 weeks or greater, so 28 days. And then the interval between the third and fourth dose, so that last primary dose and your booster dose, is going to be 3 months or greater. Then when we look at Moderna, it's very similar. Moderna does have that different age group, 18 years of age and older. It's 3 primary series doses with 1 booster dose, so the same as Pfizer. The interval between the first and second dose is a little different between the two. For Moderna, it's going to be 4 weeks or 28 days. And then the interval between your second and third dose is again going to be 4 weeks or 28 days. And then that interval from your third primary dose to your booster dose is going to be 3 months or greater. And it's important to note that the same mRNA vaccine product should be used for all the doses of the primary series. So those 3 doses in your primary series, if you start with Pfizer, you should do dose 1 is Pfizer, dose 2 is Pfizer, dose 3 is Pfizer, and then your booster dose could be Moderna if you so choose, or you can stick with Pfizer. Those are the preferred. You could even do J&J, but it's not the preferred vaccine. Okay, next slide, please. Now we're going to talk about the recommendation for moderately or severely immunocompromised. If you are using J&J or you have someone maybe who already received J&J, this has been updated with the Janssen vaccine. It is for those 18 years of age and older. It's recommended that they get 1 dose of J&J followed by 1 dose of mRNA vaccine. Then they get a booster dose. So this is different. They didn't used to have a recommendation for that was different between general population and those who are moderately or severely immunocompromised. So this is new. The interval between the first and second dose is going to be 4 weeks or 28 days. And then the interval between the second and third dose is going to be 2 months or greater. And then these individuals would not receive a 4th dose like the Pfizer or Moderna. It is not recommended that way. Next slide, please. So because of this change in recommendation, there are going to be some special situations. And one of those is there's going to be individuals who have received J&J already and already received a booster dose, and they are moderately or severely immunocompromised. So what do we do with those individuals because they didn't go along that new regimen of getting 1 J&J, 1 mRNA, and then a booster dose? So for these recipients, regardless of the type and timing of vaccine that was received as the second dose, you're going to administer Pfizer or Moderna vaccine as the 3rd dose at least 2 months after dose 2. In this particular situation, even though it is the 3rd dose for these moderately or severely immunocompromised people who already started the series, it's not necessarily considered a booster dose. And that's important because of that vaccine volume that I talked to you about earlier with the Moderna vaccine. So for these specific individuals who fall into this special situation, that dose that you give would be a 0.5 ml. Anybody who's just starting out the vaccine regimen, so if they get the J&J and then they get an mRNA vaccine 28 days later, and then they get that booster dose 2 months after dose 2, those individuals actually would get the 0.25 ml. So it can get a little confusing, and I would highly recommend that you use your resources to determine this. There is further guidance in Appendix B of CDC's interim clinical considerations, Once you receive these slides, hopefully they're coming in a PDF format and you can click on all these links on the slides to easily get to the resources that I'm mentioning today. Next slide, please. This is just kind of a wrap-up review of key clinical considerations regarding the booster doses. So the indication for and timing of booster doses depends on which vaccine was administered for the primary series. So you saw that there were some differences depending on which vaccine was administered. Booster product can be the same as or different than the primary series product. However, mRNA vaccines are preferred. Now, the Janssen vaccine can be considered in some situations. Those situations would be like if someone received an mRNA vaccine and they had an allergic reaction, then maybe at that point we would be able to consider a J&J. The physician would need to talk about the risks with the patient and decide, based on that. And then also, if the individual wants to receive J&J and they're well aware of the potential side effects or risks with the TTS, then they could. Or if it's impossible to be able to get the J&J vaccine or to get an mRNA vaccine, then they could get the J&J vaccine. But we really want to make sure that we are trying to give the mRNA vaccine because that's the preferred vaccine. But if one of those other instances occurs, it is possible that they can still receive J&J. And so we would rather them receive that than no vaccine. But it is important that they are aware of the risk with the TTS. We talked about the difference with the Moderna booster dose is half of the primary series dose, so 0.25 ml versus the 0.5 ml for the primary series. And then there are special considerations for moderately and severely immunocompromised people, which we discussed the differences in the recommendations between general population and then those who are moderately and severely immunocompromised. Next slide, please. Next slide. So now we're going to talk about co-administration, which is really important right now, especially during flu season. We really want to make sure that we're not just protecting against COVID-19, but that we're also protecting against flu. And so it's important that you understand that both of those vaccines can be administered together without regarding timing. So they can be administered simultaneously on the same day. And COVID-19 vaccine can be administered simultaneously with other vaccines as well. If multiple vaccines are administered at a single visit, you want to administer each injection into a different injection site. And when they refer to site, when CDC refers to site, doesn't necessarily mean a different limb. It's just a different site within that same muscle. And you want to make sure that you separate the injection sites by 1 inch if possible. That's a best practice for multiple injections. Other best practices are to label the syringe with the name and the dosage of the vaccine, lot number, the initials of the preparer, and then the beyond use time if applicable. And the reason for that is when you have a lot of vaccines that you're giving, it's important that you know which vaccines you're giving by time you get into the room after you've drawn them up, and then where you're giving them as well. Administer the COVID-19 vaccine and vaccines that may be more likely to cause a local reaction in different limbs if possible. That just helps with adverse reactions that individuals may have if they get a lot of redness or swelling, and some of the vaccines are known to cause more redness and swelling, so putting those in different limbs is helpful. Next slide, please. All right, now we're going to talk about monoclonal antibody treatment and COVID-19 vaccination. There has been an update with the recommendation to this. Next slide. If you recall, for people who received COVID-19 antibody products, so the monoclonal antibody therapy, there used to be a recommendation to wait 90 days before vaccination. That is no longer the case. So COVID-19 vaccination does not need to be delayed anymore following receipt of monoclonal antibodies or convalescent plasma. However, if people previously received a COVID-19 vaccine and then they need administration of tixagevimab, I can't even say these that great, but siglovimab or Evusheld, for pre-exposure prophylaxis, those should be deferred for at least 2 weeks after vaccination. So if you have someone who received COVID-19 vaccine and they need one of those products for pre-exposure prophylaxis, it should be deferred for at least 2 weeks after vaccination. Next slide, please. You can go to the next slide. So this is the CDC's interim clinical considerations, and this is a great resource. All of the updates that I went over with you today can be found in this resource. You'll notice in the green box there, it gives a summary of the recent changes, and that's what you see when you go to this web page right at the top, and you'll see that it was last updated yesterday. And so that update about that 8 weeks I was talking about earlier, that's why that changed. It actually was updated February 11th before that. So it's constantly getting updated, and when updates happen, this is the document that gets updated. So I would highly encourage you to bookmark this as a favorite. It's actually at the top of my favorites list, and I access this every single day. When people ask questions, this is what I use as a resource to show them where information is. Majority of questions can be answered in this document, so I really highly suggest that you bookmark this. The website is at the very bottom part of the slide. And when you go to this page, the screenshot you see on the left, that's what you come to and you see it first. And then on the right-hand side is going to be all the different sections that they have. So you can kind of skip to a section if you want. However, I will tell you, if you're looking at this on your phone, those sections are not up like that. So you wouldn't be able to select a specific section. Okay, next slide, please. Next slide. So the emergency use authorization fact sheets, these are something that should be given out when vaccines are given. They do have different ones. They have ones for healthcare providers. You're probably familiar with these. And then they also have the recipient fact sheet. And the recipient fact sheet is what needs to be given out when an individual receives a vaccine. Here in Michigan, we have specific ones that need to be given out because they have added language about MICR, letting the patient know that their immunizations are being put into our Michigan Care Improvement Registry system. In order to get to the Michigan EUAs, this is how you would do it. If you go to the website at the bottom of the page, you would come to that top left-hand screenshot, and you'll see product-specific information and EUAs. There you would click on whichever one it is that you're looking for, Pfizer, Moderna, or J&J. Then it takes you to that bottom one where you'll see that it shows the fact sheets for healthcare professionals and then also for the recipients. So you can click on whichever one it is that you need. And then the screenshot on the right just kind of gives you an idea of what the 12 years and older, the gray cap product for providers looks like. So this is also a great resource, especially if you have questions about storage and handling. And you need more information. A lot of stuff, when things get changed, it also gets changed in the EUA, and a lot of times first. So this is a good resource to look at as well. Next slide, please. And then just a few resources that I want to go over with you. Next slide, please. This is CDC's webpage where they have tons of vaccine product information. And as you can see here in the red box, you can select whichever vaccine it is that you're looking for information on. There's the Pfizer, Moderna, or J&J. And when you click on each of these, it goes over a lot of different things. There's vaccine preparation and administration summaries. There's also storage and handling summaries. There's frequently asked questions. There's, as you can see here, pre-vaccination screening forms. They have them in different languages. So there's a wealth of resources in this area. So I'd highly encourage you to become familiar with that. Next slide, please. Here's another great resource that CDC has in regards to the COVID-19 vaccine booster shots. This was just updated. This is a public-facing website as well, but it does help with the recommendations if you have questions, and then in conjunction with those interim clinical considerations I mentioned earlier. Next slide, please. This is MDHHS's COVID-19 provider guidance and education website, and this is also has a lot of great resources on it. We just created a COVID-19 provider guidance document, which lists all the different vaccines. It goes over what the primary series is, what the booster doses is. It talks about the difference between general population and moderately or severely immunocompromised. So that's a great document. We just updated that with the new updated recommendations. And so that should be posted here shortly, if not already. Another great thing on here is we do have a checklist for new providers. So if you know of new providers coming on, to help them get started. We also have our webinar information on here. I don't know if any of you have attended our Noontime Knowledge webinars, but we do hold those. We started holding those every other week at first. Now we are kind of just doing them as needed, as new things come up. We probably will be doing one here in the next couple of weeks. But you can see on this screenshot, you'll see under content specific COVID-19 resources, it lists webinars there. That's where we post all of our information. If you click on that, the Zoom link will be there. We don't generally do CEUs, but it's just for any healthcare provider who wants to attend. We also have all of our recording and slide sets listed on that webpage as well. So if you miss it or you want to go back and listen to them, those are available too. Next slide, please. And that's all I have for you. Sorry, I know that was a lot of information. I was trying to get it through it quickly. If you have questions, I can take questions now if we have a little bit of time. And then otherwise, if you think of questions later, you can always email us at check-ins@michigan.gov.
Thank you, Andrea. That was a great presentation. And we do have a little bit of time for any questions. It looks like we have some in chat. I'm just going to open up chat here. Or maybe we don't have any questions in chat. Sorry about that. Was there anything I'm missing, Kim, in chat?
No, I just added the evaluation, and also the slide presentation is also in the chat. It's probably just the first chatted item that I had put in there.
Okay.
And thus far, we don't have any questions.
Kim, do you know, does the PowerPoint slides, do those come over as a PDF to the participants?
Yes, they do, and they are able to access the links that are in your presentation.
Perfect, perfect.
Andrea, I have a question about the vaccinations. Why does the CDC feel that it is safe to give different boosters, but not different ones during the series? It's the same, but then the booster can be anything. What's the logic behind that? Do you know?
Yeah, I mean, there isn't really anything in stone, I would say, that's, really pushing that, other than the fact that they don't really have a lot of data in the primary series to determine, switching the different products, because when the most data that they have is people getting the same product, especially for the primary series. Now, when they were looking at booster doses, they had more data on different products being used for the booster doses. So I think that's why they felt more comfortable. Also, with the data coming out showing that, some of the booster doses may be more effective than others, or with the different products, and people wanting to choose a different booster. I think that's one of the reasons too why they made that recommendation available. So
Thank you.
Mm-hmm.
And we did just get a question from Barb about, is there anything on the horizon about a second booster?
Not that I've heard, although I'm pretty sure I've seen something pop up in my email today. So it sounds like there might start being some discussions about that, but not anything that's going to be coming soon, I would imagine. So I have not heard anything, but I thought I saw something pop up in my email today about an article regarding that. So it's possible that we could start seeing something along those lines.
Are there any other questions? People can just put their questions in chat, or else they can unmute themselves if they'd like to ask a question. Oh, well, while we're waiting for any possible further questions, I did just want to let everyone know our session next week on March 2nd will be on motivational interviewing as it relates to the COVID vaccine and boosters, and Mia Croyle will be our presenter. And I can just tell you, for those who haven't heard Mia before, she's a great presenter, so you won't want to miss it. Not seeing anything else. Any other questions just from anybody else? I just want to make sure before we close out for the day, we're almost at time too.
I will tell you, too, we have not heard anything, and this doesn't really apply to this group though, but we have not heard anything about booster doses for the younger age group either, because that's a question we've been getting a lot on.
That is, thank you for sharing
So
that.
that under age 12, we have not heard anything on that as well.
Well, that's great to know, because I'm sure that is, while we probably do have a little bit more specific age group here that we're working with, it's always kind of good to know just even about across the board. One other thing I wanted to add to, and we can list those resources. I know you had the resources for the for some of the different documents for the Michigan Department of Health and Human Services. And we can share some of that too as it relates to Minnesota and Wisconsin, because I know we got people from all 3 states here. So we can get those shared on our site too at Superior Health. With that though, it looks like we're at time. I want to thank Andrea. That was a wonderful presentation. Thank you for joining us today and presenting. And thank you to everyone who joined us on the session and participated. And we'll see you all next week. Thank you.
Thank you. Thanks for having
Bye.
me.